Here's my audience.
Yes.
So, does anyone know any families or anybody affected by spina bifida?
I do.
You don't?
No, I don't.
Okay.
But I've seen it on television.
A good friend of mine's daughter has spina bifida. I took this opportunity to educate myself more about her condition and how it affects her life. I hope to enlighten you to the different types of spina bifida, how it is diagnosed, risk factors, and prevention, as well as how it is treated and support for ongoing care. Spina bifida is a very complex condition, and by learning more about it, I hope to understand better what my friends' daughters face with, and better how to support them as friends. So what is spina bifida? Spina bifida is a condition that affects the spine and is usually apparent at birth. It is a type of neural tube defect. Spina bifida can happen anywhere along the spine if the neural tube does not close all the way. The backbone that protects the spinal cord does not form and close as it should. This often results in damage to the spinal cord and nerves. Spina bifida may cause physical and intellectual disabilities that range from mild to severe. The severity depends on the size and location of the opening in the spine, whether part of the spinal cord and nerves are affected. This is according to the Centers for Disease Control in the United States. Also by the CDC, there are 3 types. Myelomeningocele is the most serious type of spina bifida. With this condition, a sac of fluid comes through an opening in the baby's back. Part of the spinal cord and nerves are in this sac and are damaged. This type of spina bifida causes moderate to severe disabilities such as problems affecting how the person goes to the bathroom, loss of feeling in the person's legs or feet, and not being able to move the legs. Now, the most serious part of that type of it is that the nerves are actually exposed in the womb. They're actually outside and uncovered by any skin or muscle or anything. They're actually outside the spine and exposed. So not only is the spine exposed, but the neural tube, the spine, is exposed all the way up. So there can be pressure in the skull, which can lead to hydroencephalitis. The second type is meningocele. With meningocele, a sac of fluid comes through an opening in the baby's back, but the spinal cord is not in this sac. There is usually little or no nerve damage. This type of spina bifida can cause minor disabilities. In that one, the fluid, and there's a sac outside of the back, but the nerve stays where it's supposed to, so it's less severe. But they still get hydroencephalitis is one of the major problems with that still. And the third type is spina bifida occulta. This is the mildest type of spina bifida. It is sometimes called hidden spina bifida. With it, there's a small gap in the spine, but no opening or sac on the back. The spinal cord and the nerves are usually more normal. Many times, spina bifida occulta is not discovered until late childhood or adulthood. This type of spina bifida usually does not cause any disabilities. These 3 descriptions were by the CDC. This can go undiagnosed throughout life. This one is not usually caught during in utero, and it's not even discovered sometimes until after birth or at all. Sometimes there's a fleshy spot or a little spot of hair in the middle of the back where the gap was, but that's the only indication. But they, other than developmental defects, but they could be mild at that. Spina bifida is diagnosed in 4 different ways. Alpha-fetoprotein, protein that is produced by the baby and can be tested in the mother's blood. High levels of AFP are an indicator that the baby might have spina bifida. This test is part of the triple screen that looks for multiple genetic and developmental concerns. This is often and routinely performed during almost all pregnancies that are treated with conventional medicine. The second way of finding spina bifida is by ultrasound. an ultrasonic picture of the baby and the womb. The deformation of the spinal column can sometimes be seen with this test. So it would be if there's the sac or if there's the gap, they can sometimes see the gap by the occulta. But oftentimes, and they check the spine as a part of all ultrasounds. They check the spine, so it's routinely caught during ultrasound. Third way that they find spina bifida is amniocentesis. This test takes a sample of the amniotic fluid in the womb. This test measures for high levels of AFP as well. So much like the triple screen, which is a blood test, the amniotic is also a test for the same protein, the alpha fetoprotein. And the fourth way is by postpartum. If find diagnosed during pregnancy, then it can be discovered visually after birth. X-rays and other imaging methods can be used to find deformation in the spine. Risk factors and prevention of spina bifida, according to the Mayo Clinic, and according to the Centers of Disease Control and Prevention, there are approximately 1,500 cases of spina bifida per year in the United States. Causes are not known for sure. There are many factors, but there's no known causes. They don't know how it actually happens and why exactly, but they do have risk indicators as to why it is. Race is one indicator. Whites and Hispanics are more prone. According to the CDC, 3.22 to 4.177 per 10,000 births. It's a very small percentage, but it's higher than African Americans or Southeastern Pacificers or South Pacificers. So it's a very small percentage, but they have a higher percentage of whites and Hispanics. Sex is also an indicator. Females are more prone. There's also family history. If it runs in your family, they're more likely to have spina bifida. And if a woman has spina bifida, her children are much more likely to have spina bifida. And we often think of them not being reproductive, but like in the case of the occulta, where it's not very severe, it's much more likely to carry on. Also, folate deficiency, also known as folic acid. Experts recommend that, according to the Mayo Clinic, experts recommend that all women of childbearing age take a daily supplement of 400 micrograms of folic acid daily. That's one of the main methods of prevention, and almost all groups and support groups all talk about advocating and informing everybody that to take all women of childbearing age to take folic acid, which is the supplement. It is folate. Folate's also found naturally in foods. Anti-seizure meds such as valproic acid can increase risk if taken by a mother during pregnancy. It's just shown a higher rate whenever epileptic mothers had that medicine. They didn't find it out till later through studies that it does tend to have more risk of having spina bifida. Diabetes before conception and during pregnancy. Also obesity both before conception and during pregnancy. Increased body temp caused by hyperthermia. Usually this is thought to be by sauna or hot tub. And most of these, whenever they're worried about development, spina bifida happens in the first couple of weeks to very early in the conception and the pregnancy. So it's very early in the pregnancy when these things are a risk. So later on, they may not, even if a woman were to be epileptic, if she had stopped her medicine when she was conceiving, she could possibly take it again second trimester and on and probably be fine, because spina bifida only happens early on in the pregnancy. The treatment and support of spina bifida: in utero surgery and birth by cesarean section. Depending on the severity of the spina bifida, if it's the myelomeningocele, sorry, that's a hard word to say. If it's the one with the exposed nerves in the back, they're more likely to do the in utero surgery, and that's to help the baby survive. It's more likely that they won't survive pregnancy. to full development. Now, the risk with the in utero surgery is that they tend to be born earlier. They don't usually carry to term, so they tend to be premature if they do the in utero surgery. Also, they may opt to do a cesarean section. Spina bifida babies tend to be feet down for some reason. They don't know why, but they're more likely to be foot down. So they tend to be born by cesarean section for safety precautions. On top of the hydroencephalitis with the enlarged head. So, post-utero shunt and surgery. A shunt is a small hollow tube that will help drain the fluid from the baby's brain and protect it from too much pressure. Additional surgery might be needed to change the shunt as the child grows up or if it becomes clogged or infected. Our friend, their daughter has a shunt. It pretty much stops the fluid from overpressuring in the brain and allows it to go back into the body to be naturally absorbed. It doesn't run out anywhere. It stays in the body, but it's a natural fluid and it absorbs by the body naturally. They have to go get surgery if it ever gets blocked, and she'll get too much pressure on her brain. I know that they've talked about that. There's also support groups and services offered, such as Spina Bifida, Texas. Each state has its own, and some states will there's one of the Carolinas, so North and South Carolinas have a support group together, and there's also local level groups. There's online chat and support. I came across one site that was a chat group for people with spina bifida, so they could talk to adults, could talk to teenagers and children, and they could all help each other. And one of the worst parts of spina bifida is that they all seem isolated because there's so few of them. There's only 1,500 born per year in the United States, approximately. They may not know anybody else with spina bifida or ever see what their experiences are or have anybody to relate to, so they feel very isolated a lot of the time. Education professionals and education system are a big source of support. They have spina bifida camps where kids can go and be around other kids that have spina bifida, and they can have health care while they're there, and they can go to camp just like all regular kids and do as much as they can or want to do within the camp. Medical teams involved in groups. Many of the support groups have medical teams. Hospitals. The Mayo Clinic has a lot of experience with spina bifida. They have their own medical team devoted to spina bifida. So there's very specialized groups within the medical field for spina bifida. They're not everywhere, but there are specialized teams. Some of the support services offered by some of these organizations are new parent counseling, and all of this was found off of Spina Bifida, Texas. Library and research. They'll have libraries, both online and physical libraries at their organizations. They have lending closets for equipment, clothes, whatever somebody with spina bifida may need. Advocacy and educational support, such as the folic acid awareness for women of childbearing age. Also, to do screenings, to do the triple screen is one of their advocacies, and just kind of make people aware of what it is and how it affects them. They have scholarships for spina bifida students all the way up through college. Independence training and life skills. Some of their they have some of their disabilities, such as incontinence or being able to go to the restroom. They need to be cathetered, or they may have special needs in that area. Being able to walk. They may be on a walker. They may have crutches. They may be in a wheelchair. They may be wheelchair bound, either mechanical or electric. So they need a lot of help there with that, and being able to cook. And part of that's with the hydroencephalitis that occurs. It causes brain damage, so they may not be as high of may not be above a high school education level or thinking process. So they may not be ever be fully self-sufficient. They may need help, and they may be able to with help. They have a conference Many of the groups have their own conferences, and then there's a national conference, and they have medical conferences for it also. And there's also, and then the prevention awareness. That's mostly the folate awareness. Spina bifida is a neural tube defect that greatly affects many people. I discussed with you spina bifida's types, how it is diagnosed, risk factors and prevention, as well as how it is treated and support for ongoing care. I hope that we have all learned more about this disease and how it affects individuals, families, and our communities. Maybe through knowledge of the disease, you will be more familiar with how spina bifida can be prevented, treated, and how to support those affected. Thank you for your time. Do y'all have any questions?
No?
No? Okay.
Thank you.
Thank y'all.